Section 1. What is community diagnosis? A simple start. Community diagnosis is like a health checkup for an entire community. It's a systematic way to understand the health status, challenges, and strengths of people living in a specific area. We gather and analyze information, not just about diseases, but also about social conditions, environment, and available resources. The goal? To get a clear picture of what helps or harms the community's well-being. Health professionals and community members work together, listening and observing, to identify real needs. Instead of guessing, we use evidence to make informed decisions. For example, we might link a rise in asthma to local air pollution, not just hospital records. Community diagnosis combines hard data with lived experiences, revealing the full story. By pinpointing health needs and their causes, we can design targeted, effective health programs. It's the essential first step to building healthier, stronger communities. Like looking under the bonnet before fixing a car, it prevents wasted effort and missed problems. Community diagnosis sets the foundation for meaningful action. Section 2. The How-To Guide. Steps for community diagnosis. First, define your community by location or group. Next, build a team and connect with local leaders to ensure partnership and trust. Then, collect data numbers like disease rates and stories from interviews or observations. Use both quantitative and qualitative methods for a complete picture. Analyze the data to spot patterns and root causes, like linking malnutrition to lack of fresh food. Prioritize the most urgent and solvable health problems. Share findings with the community in clear, accessible ways. Collaborate to create a health improvement plan with specific, measurable goals. The process turns knowledge into action. Community diagnosis isn't just a report. It's a roadmap for real change. Involve everyone, from officials to residents, for lasting impact. This cycle of assessment and action drives healthier communities. Community diagnosis is vital for effective health planning. It ensures interventions are based on real needs, not assumptions or averages. This saves resources and targets the actual problems, like poor sanitation or lack of prenatal care. The process empowers communities, making residents active partners in improving their own health. When people are involved, they're more likely to support and sustain health initiatives. Community diagnosis guides resource allocation, ensuring funds and efforts go where they're needed most. It also provides a baseline to measure progress and evaluate success. By comparing before and after data, we can see what works and adjust strategies. This creates a continuous cycle of improvement and accountability. Community diagnosis creates targeted, effective health interventions. It builds trust and empowers communities by involving them in the process. But it can be resource-intensive, requiring time, money, and skilled people. There's also a risk of community fatigue if no real change follows. Accurate data is crucial. Combine official stats with community input for a balanced view. Use well-designed surveys and trained data collectors to ensure honest, useful answers. Pilot your tools to catch problems early. Despite challenges, the benefits, better targeting, empowerment, and efficient resource use, are immense. Community diagnosis is the foundation for evidence-based public health. Done right, it leads to healthier, more resilient communities.